At the American Psychiatric Association Foundation, our vision is to build a mentally healthy nation for all, where we live, learn, work, worship, and play. We believe that this vision can be realized when we commit to our Notice, Talk, and Act framework. Let's start with notice. Knowing what to look for as changes in ourselves and others may signal concern for our mental health and well-being. Not waiting, but moving upstream to notice changes earlier. Much earlier. This would mean closing the years-long gap between the onset of mental health conditions and connecting with care for the growing rates of youth and young adults experiencing these conditions. Recognizing the key roles schools can play in noticing early warning signs of youth struggling and supporting staff to act. Ending the practice of booking about 2 million people with serious mental illness into local jails every year, and encouraging workplaces to play a role in tackling the fact that less than half of people experiencing mental health conditions receive care by making workplace mental health a high priority. When it comes to talk, hats off to those speaking up about mental health. Let's build on that progress. That's what breaks down stigma. More athletes and celebrities are sharing their experiences managing anxiety, depression, and how they are taking care of their mental health. Political leaders on both sides of the aisle are talking about the growing crisis of people attempting to access mental health and substance use care, and the growing crisis in suicide and drug overdoses. Students are sharing their experiences with mental health through the Well-Beings Initiative, showing courage and resolve, and so their peers feel less alone. And faith and corporate leaders see the power and importance of using their platform to talk about mental health, integral to breaking down barriers to people accessing care. That brings us to ACT, a place to join forces around a common purpose of ensuring people get the help they need when they need it. Accessing mental health care should be as easy as getting a cast for a broken bone. Investing in building the mental health primary care and peer support workforce needed to improve access to care for the escalating mental health needs in communities across America. Training and supporting primary care practices to routinely screen for and deliver effective mental health care using the research-based collaborative care model. And training faith leaders, teachers, community programs, and workplaces on how to respond with compassion and empathy, and knowing how to connect people with mental health and substance use care when they notice someone in need. Join the APA Foundation's efforts to demystify and destigmatize mental health, offering help and hope to millions in need. For more information on the Notice.Talk.Act program, visit www.apafdn.org.